We've adapted the Sinclair Compassion Questionnaire, the SCQ, to suit a wide range of requirements. Our questionnaires are split into two categories: gold standard questionnaires, most suited for research, and adapted questionnaires, most suited for clinical use and future measurement studies. They're all available in English and French, with Spanish on the way. And the best one for you will depend on your role and the setting you work in. In this video, we'll talk about what's on offer and look at some examples along the way. Let's look at the gold standard first. The gold standard SCQs are at the heart of our work. They are the result of a decade of rigorous psychometric testing. They're valid, reliable, clinically relevant, and especially useful for compassion researchers who need rigor to support and validate their work. The original 15-question gold standard SCQ was created to help build a deep and detailed understanding of how patients are experiencing compassion on a weekly basis in acute care, long-term care, and hospice settings. The 5-question SCQ-short form is a compact version of the 15-question SCQ, made up of the highest loading questions from the original SCQ. While still maintaining its psychometric rigor, it's best for quick delivery within busy clinical settings or embedded within larger questionnaires. Let's take a look at an example of this in action. Kai is a compassion researcher. He wants to run a national study of oncology inpatients to understand their experiences of compassion and how they vary by age, care setting, and tumor type. He knows that a rigorous measure will be the key to making his work a success, and that having access to a valid and reliable questionnaire will ensure his findings are robust and valid. Kai chooses the 15-question SCQ, the most robust compassion measure, to give him the breadth and depth of data and confidence that he needs. But what if you aren't a researcher? What if your patients stay for less than a week? What if you want to make improvements to compassion in your day-to-day work? This is where the SCQ adaptations come into play. Our SCQ adaptations were built on the same evidence base as the gold standard SCQ and are tailored to meet the needs of specific settings, patient populations, disciplines, and educational contexts. While future research is conducted to further fortify their validity and reliability, they give clinicians evidence-based compassion questionnaires that are practice-ready. Let's look at a few examples to see how some of them work. Alex is a nurse working on a short-stay surgery unit. While their patients are only with them for a few days, they know that compassion matters for people going through a health crisis. They want to know their patients' individual preferences for care and how they and their colleagues respond to those preferences over the course of their patient's short stay. When patients are admitted, the SCQ Importance Questionnaire will allow them to assess each patient's individualized preferences for compassion. This establishes a baseline for each patient, allowing them and their colleagues to tailor their care. Every 24 hours, they also use the short stay hospital adaptation of the SCQ to measure their patients' experiences of compassion. Using both of these tools, they can get a clinical snapshot of what's important to their patients and track how they and their team are doing thereafter. Juliet is the director of an outpatient cancer center that cares for outpatients receiving radiation and chemotherapy. She wants to understand how her care teams are delivering compassion. Because their patients are only there during the day, their experiences of compassion will be different to patients in inpatient care settings. That's why she decides to use the SCQ Outpatient Treatment Questionnaire, tailored from the original gold standard for this exact purpose. Even within a short time window, measuring compassion at each patient clinic visit allows her to build an understanding of how compassion is being delivered in the treatment areas. Jaspreet is a clinical educator at a teaching hospital. He wants to give his trainees the tools they need to support their capacity for delivering compassion. At the same time, he also knows that compassion is a deeply personal thing, something that we all experience and express in different ways. To understand individual learner differences in compassion competency and to provide learner-centered training, he administers the SCQ Learner Competence Self-Assessment before and after training. This lets him know how each individual learner has grown as a result of his compassion training. For most every scenario, there's an adaptation of the SCQ that can help you improve compassion for the benefit of patients, all based on years of rigorous study and research. There are far more options available than just the ones we've talked about in this video though, so make sure to take a look at our website to see what's available, including how you can use the SCQ in your personal practice.